Hi, I'm Paul Sufka, coming to you from ACR 2019 in Atlanta, Georgia. I'd just like to talk a little bit about one abstract that has gotten me really excited during this conference. It's abstract 1161, and this is an abstract where they looked at gadolinium-enhanced contrast in patients who have polymyalgia rheumatica, specifically looking at their shoulders. And the thing that they found in this abstract was that there is pretty good evidence of inflammation, including things like capsulitis, osteitis, and rotator cuff inflammation in both patients who have a new diagnosis of polymyalgia rheumatica and in patients who show evidence of recurrence. Slightly different findings in each, but nevertheless, there's clear evidence of inflammation in these patients. Now, why would something like this be interesting? Well, despite the fact that us as rheumatologists see a lot of cases of polymyalgia rheumatica, it's usually fairly simple. We tend to get the cases that are a little bit more difficult. And in the cases where I'm a little bit confused about, is this really polymyalgia rheumatica, or maybe later in their presentation or their management, when I'm tapering their steroids and saying, well, is this a flare of their polymyalgia rheumatica? Has tapering their steroids just simply unmasked their underlying osteoarthritis? Are they having some symptoms of steroid withdrawal? Now I know I can do an MRI with contrast of their shoulders and help me differentiate, what exactly is going on. And I think this is important because the mainstay of treatment for polymyalgia rheumatica continues to be corticosteroids. And as rheumatologists, we really know that it's important for us to try to minimize the exposure to these medications to our patients because we just know that there's tons and tons of side effects. I could go over the list, but includes infection, osteoporosis, weight gain, diabetes, cataracts, etc., etc., etc. So I'm also submitting an article to the rheumnow.com website on this, so read for a little bit more details.